My name is Will Dasher. I'm an orthopedic spine surgeon at OrthoGeorgia, where I've been practicing since 2002. I'm here today to talk to you a little bit about minimally invasive lumbar surgery. And when I say lumbar, I mean lower back. There are a multitude of what we consider minimally invasive surgeries. And in layman's terms, laser surgery or any sort of surgery where you try to disrupt the tissues as little as possible could be considered minimally invasive. And all of us here at OrthoGeorgia try to use minimally invasive techniques whenever they are appropriate. And specifically in the lumbar spine, one of the most common minimally invasive surgeries we do is a microdiscectomy, where someone has a disc herniation, where the piece of disc, say in the lumbar spine, herniates or moves from a normal position into an abnormal position and pushes on a nerve. It causes severe leg pain, and those people are just miserable. Well, it's a very easy, simple procedure to make about a 1-inch incision, going through the back and using a microscope, remove that piece of disc. And it's very effective. People go home same day and have relatively little post-operative pain. So that's one example. Another example is a minimally invasive lumbar fusion. In a lumbar fusion, we're trying to get the vertebrae to grow together. Either that segment is unstable or has a lot of arthritis. In certain circumstances, then we can do a minimally invasive fusion, where we're basically working through little tubular retractors to put in a small cage between the vertebrae, to put in what we call pedicle screws, which are just points of fixation on that vertebrae, and we actually stabilize the vertebrae with those little screws and rods and get the vertebrae to fuse together. Those are just a couple of examples. We can also come through the side, do a little small incision. And in these cases where you're a good candidate for minimally invasive surgery, it can make recovery a whole lot easier. So when you come to OrthoGeorgia, we're going to evaluate you, see what your problem is, and decide, first of all, do you need surgery? If you need surgery, the first thing we think of is, can we do it through a minimally invasive approach? If you have any problems like this, especially with your lower back, please come see us and we'll work this up and see what's best for you.